Hello, I'm Connie O'Connor. I am a nurse practitioner in the Ehlers-Danlos syndrome program at SickKids Hospital in Toronto, Ontario, Canada. Before I begin, I would like to thank the Ehlers-Danlos Society for the opportunity to give this talk today about holistic approaches to care for children and adolescents with hypermobility and EDS. Before I begin, I would just like to point out I have no conflicts, and I would like to especially thank Dr. Sarah Schwartz, physiotherapist Brianne Burton, and clinical psychologist Dr. Stella Dentakos for their contributions to the content of this talk. Today we'll be discussing the common presenting symptoms for children and adolescents that we see in our EDS clinic. Also, the things that we consider when providing care for children and adolescents. And finally, taking a holistic approach to symptom management and patient care. Just as a definition, holistic care recognizes that a person is not simply their illness or symptoms. Holistic care seeks to address the person's physical needs as well as their psychosocial needs. Some of you may be familiar with the biopsychosocial model of care. The goal of this model is to promote a more person-centered approach to care, in which social and psychological dimensions are simultaneously considered alongside biological factors when looking at an individual's health status. And you can see from the model that where these three realms intersect is actually what we know as health. As we know, the relationship between these domains is very much interrelated, dynamic, and quite complex. Childhood and adolescence is particularly unique, as this is a time of rapid physical growth, hormonal change, personality development, a move towards independence, and development of the self as a person. In our clinic, more than 80% of referrals are for hypermobility and pain. As we know, hypermobility and pain are correlated with a higher than average prevalence of anxiety or other mental health concerns. Therefore, addressing mental health along with physical symptoms is important to developing effective holistic treatment approaches. I'd like to spend a moment on the mind-body connection. There is a very clear scientific understanding that the mind and body work together and affect each other. There is two-way communication between the mind and the body as signals travel up and down the nerves between them. Also, hormones which circulate in the bloodstream can be produced by the brain and affect the body, or vice versa. Some hormones are made in the body and affect the brain. We all know that everyday thoughts, feelings, and stresses can play a part in making demonstrable changes in our bodies. For example, when we feel a bit embarrassed, we may blush. When we feel worried or frightened, this can cause butterflies in our stomach, increased heart rate, or sweaty palms. We also know that our emotions can have an effect on how we feel. Feeling stressed out can heighten body pain and contribute to things like tension headaches, for example. Acknowledging the psychological does not invalidate physical symptoms. Psychological impact is very real. Physical symptoms are very real, and both need to be acknowledged and addressed. This is an important lesson not only for patients and families, but also for healthcare providers. I'd like to spend some time focusing on pain, which is a common symptom that we see. Pain can be either acute or chronic, and much is known about the persistent pain cycle in people who specifically have joint hypermobility. Hypermobility can increase the potential for soft tissue injuries, subluxations, or dislocations, and these can lead to pain. Pain often leads to decreased physical activity, causing decreased functioning and physical deconditioning, which in turn can worsen joint laxity. This cycle can also be reversed. For example, pain may cause changes to posture and movement, leading to increased risk of injury like dislocations, which can worsen joint laxity, and so on. In taking an approach to pain, the treatment of pain and breaking this persistent pain cycle has been shown to be most successful when taking what's known as the 3P approach to pain management. So first, addressing the physical aspect of pain includes daily activity and exercise pacing, application of cold or heat to sore muscles and joints, massage, physiotherapy, and/or occupational therapy. Addressing psychological aspects of pain include mindfulness, distraction, deep breathing, imagery, and changing a child's thoughts towards pain. It can also include effective parental responses to pain. So while we know that it's difficult for parents to see children in pain, how they respond and encourage children to continue to engage can have a big impact. And finally, the pharmacological treatment of pain can include over-the-counter and prescription pain relievers, adjuvant medications for nerve pain, and antidepressants for anxiety or depression. If we look at hypermobility, we know that hypermobility can occur in just one joint or in several joints. Joint hypermobility is common in the general population and is not unique to connective tissue disorders like EDS. A joint can be hypermobile for several reasons, including bone shape and shallow joints, having loose or lax connective tissue such as ligaments around the joint, or having low muscle tone. In terms of managing hypermobility, staying active is extremely important. We want to strengthen the muscles around the joints. We also want to make sure that our cardiovascular and aerobic health is maximized. We would like to include that children maintain physical education at school unless there's a specific reason why they should not participate. Stopping exercise can lead to weaker muscles and lower endurance, which actually can make hypermobility and pain symptoms much worse. Physiotherapists can help work on strategies to participate in activities with less pain and fatigue. Looking at lower impact activities like biking and swimming are good ways of maintaining physical fitness with less effect on your joints. Contact sports like hockey or football should be avoided due to the increased risk of joint injury and, as pediatric healthcare providers, the risk of head injuries. Some activities which exploit and encourage joint hypermobility, like gymnastics, may also increase the risk of injury and persistent pain in hypermobile individuals. It's important when you're considering a sport or activity for children or adolescents that you consider not only their current engagement, but also the progression of skills and physical demands that the activity will require as children mature. It's often much harder to stop a sport or activity when it becomes more risky once a child has learned to love it and bonded with their team or their coach. People with joint hypermobility are often described as being more clumsy than their peers. This can lead to frequent falls and injuries like sprains. Proprioception is a person's sense of where the body is and how the body moves in space. Studies in children and adults show that people with joint hypermobility demonstrated decreased proprioceptive acuity compared to their non-hypermobile peers at baseline. Studies have also demonstrated that physical therapy focusing on proprioceptive training can improve proprioceptive acuity and help to improve symptoms of pain. Balance and coordination are skills that can get better with practice. The approach to physiotherapy in hypermobile children and adolescents may be very different from standard approaches to injury rehabilitation. This is because the focus is on injury prevention, increased body awareness, and overall improvement in motor function. As per my physiotherapist colleague, Brianne Burton, we start with body awareness. The goal of physiotherapy in children and adolescents is to start simple. And the first step is really muscle education. So are they able to tell when muscles are tensed versus relaxed? Can they grade muscle contraction? For this, we use tools that provide sensory and visual feedback, like balance bubbles, yoga balls, mirrors, and we play balance games. We do posture training and activities that require slow and controlled movements. Often, activities that require stopping and holding positions can also be helpful. The second step is really core and muscle training. However, training does not necessarily mean strengthening. It's really about, can they feel their muscles? Can they relax their muscles? And can they control their muscles in their trunk and core? Breathing is actually a good place to start. We finally want to look at neuromuscular integration, which is really combining proprioception, trunk and extremity muscle control, coordination, and balance. We often use things like a ball or slider to facilitate movements, rather than having patients reach out into an empty space. Activities can include coordination drills like dribbling a tennis ball, tapping targets with their feet, or throwing and catching a light ball to themselves. Why does functional strengthening last? Really, what we want to do is teach patients how to sense their body and control muscle tension before we add stress or load to the movement. It's important to build a strong base before trying to strengthen distal muscles. We want to teach patients to use their muscles efficiently and appropriately before we add stress or load to the movement. This also helps to avoid reinforcing bad habits like dysfunctional movement patterns. Another crucial component of holistic care is looking at mood and anxiety. We know that 70% of mental health problems have their onset during childhood and adolescence, and half of all mental conditions start by the age of 14, with unfortunately most of these being undetected and untreated. Mental health issues may impact other symptoms and overall well-being. So where do we start? Very simply, it's important to first have awareness. So we know that children with EDS and hypermobility have unique psychosocial stressors and needs. We need to identify these needs. So we have to ask our children and adolescents about their mood, their coping, what stresses them out. We have to actively listen for their ongoing worries and be attuned to signs that they are beginning to withdraw from their peer group or their family, that their sleep or appetite are changing. And finally, we want to look for functional interference beyond what can be medically accounted for. And we want to be attuned to how well they are adhering to their treatment plans. It's also important to be responsive to these needs. And so we should be looking at considering mental health referrals. We have to engage our patients before doing this. We need to notice what their challenges are, ask their permission, and also give them a sense of agency when engaging these kinds of professionals. Common presenting concerns that we see in children and adolescents include adjustment challenges related to their diagnosis or prognosis. We also see issues with symptom management like pain and fatigue. We see concerns around treatment adherence and or self-medication. And we see many general mental health issues like anxiety, self-concept issues, body image issues, and challenges with coping. Many factors can impact the success of mental health approaches with children and adolescents, and they need to be catered based on the child's age, their readiness for mental health support and their engagement, how much insight they have into their own symptoms, moods, and behaviors, and how severe their mental health concerns are. We also need to look at life-interfering behaviors such as self-medication or self-harm and address those urgently as required. It's important for children and adolescents with mental health struggles to have social support. So looking for the people that can help them within their peer group or their family, and also acknowledge that they may have had events in the past which have led to trauma. Some of the tools that we can use when approaching mood and anxiety challenges include things like mindfulness. And this is something that can be employed really by anyone. One of the strategies for mindfulness includes calm breathing. It's an excellent portable tool that helps people when they're stressed. It requires practice. It requires good posture, sitting upright, taking smooth, slow, and regular breaths. We can also use things like the 5, 4, 3, 2, 1 technique, which is focusing on 5 things that you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and one thing you can taste. This helps to center the individual and have them focus on their senses and overall relax. Additional approaches can be considered by a clinical psychologist who has the appropriate training. Many approaches have been looked at in terms of pain management and in terms of dealing with people who have hypermobility and pain, including cognitive behavioral therapy, which really focuses on the relationship between thoughts, feelings, and behavior. We can also use motivational interviewing, which addresses change through the exploration and resolution of ambivalence on behalf of the patient. Dialectical behavioral therapy focuses on emotional regulation, distress tolerance, and effectiveness of interpersonal relationships and mindfulness. And finally, one that is becoming more popular is acceptance and commitment therapy, which emphasizes acceptance and increased commitment to personal values. So we're reducing attempts to try to control or eliminate difficult thoughts and feelings, while we encourage increased involvement in meaningful life activities despite these negative thoughts and feelings. And finally, the importance of sleep cannot be underestimated. So poor sleep impacts mood, behavior, and an ability to learn. The brain needs sleep. Although no one is exactly sure what work your brain does when you're sleeping, some scientists think that the brain is able to sort through and store information and solve problems during sleep. Lack of sleep may increase pain and decrease the ability to cope with pain. The body needs sleep. So the average kid has a very busy day between school and activities and family life. By the end of the day, the body needs a break, and sleep allows the body to rest and repair for the next day. Lack of sleep may also affect the immune system. What is challenging is that pain and sleep can have negative effects on one another and can contribute to a cycle of poor sleep and increased pain. When you improve sleep or you improve pain, you can begin to break this complex cycle. So tips to help improve sleep include having a set schedule, exercising during the day, but not right before bedtime, avoiding caffeine and stimulants, turning off screens for an hour before bed, trying to relax either through meditation or mindfulness before bed, sleeping during darkness and waking with sunlight if possible, and also considering sort of assistance through white noise, weighted blankets, or even melatonin if needed. We have to balance the psychosocial needs of the child and adolescent with their medical needs. And childhood is a very sensitive period for growth in physical, personal, learning, cognitive, emotional, and social domains. Children and adolescents are not the same as adults. They are experiencing significant developmental challenges like achieving increased levels of independence, establishing peer relationships, developing their own sense of self, and experiencing increased personal choice and freedom. Successful approaches to care of the child and adolescent must take these important milestones and developmental needs into consideration while balancing physical and medical challenges. This is the ultimate goal of holistic care. Thank you for listening.